For us, the minutes matter. There's a nationwide push to decrease the time it takes from the patient when they hit the hospital door to the time they get to the catheterization lab. Damon Darcy, an Associate Medical Director, Mississippi Medcom and Air Care, our flight program here. We're taking it a bit further. We believe we can go out further than that. We can say by the time the patient hits the first provider, paramedic or firefighter, to the time he gets to the cath lab or the heart catheterization door, that's the time that makes a difference. So with the joint partnership with the Mississippi Department of Transportation, Mississippi Department of Health, and the University Medical Center, we came up with a plan to have a system that can utilize existing technologies, specifically the MDOT's camera system, and then we could help move patients better.
MDOT and the ITS group specifically really focus on safety of the motorist and the public as our #1 goal. I'm AC Roberts, I'm the ITS engineer with MDOT. But one of the most important ways that we do that is by sharing video. We share data with the public as well as with other agencies within the state. This makes everybody more efficient, makes everybody do their jobs a little easier, a little better, and it makes it safer for the public.
What we do is we help move patients. And we do about 75 ambulances a day inbound to our medical center. We help coordinate and dispatch our own flight service, but also manage others coming into our facility. And we do about 13,000 to 15,000 patients a year.
Mstraffic is a system that we use to manage traffic in real time.
We monitor 349 cameras statewide. Michelle McAllister, I'm a senior operator. As an operator, when we notice an incident, we coordinate with emergency responders to make sure that they have the proper information for their response. This way we can clear the roadways faster for our traveling public in the state.
It was a thought from both the Department of Transportation side and our side of how do we improve healthcare delivery in the areas in which we already have technology.
UMC was in the process of remodeling some of their facilities. They found an opportunity to set up a similar video wall in their dispatch unit. They had been using our video views from the website in the past. So we saw this as a real partnership opportunity.
And so we did a redundant connection through a fiber link through their system, and we're now able to monitor all of their cameras statewide.
Before, it was a guess as to how an ambulance could get to this hospital. You kind of had to take it on, just hit the highway, hope for the best. My name is Bruce Hollingsworth. I've been in Medcom now for 6 years. I'm a Medcom Specialist 1. Nowadays, with this new implement of the MDOT cameras, I can scan from any scene just about.
Anytime an ambulance is inbound to UMC with a critically ill patient, they're required to give a 20-minute heads-up patient report. My name is Stephen Houck. I'm a communications specialist here at Mississippi Medcom. I help coordinate emergency transfers throughout the state. At the time that they give that patient report, we can look at the traffic cams and try to anticipate any traffic delays. If this happens, we can inform the ambulance crew that they may need to take intercity roads so that a potentially critically ill patient doesn't get an increased time delay, which could cost them disability or even their entire life.
If an ambulance is going to get tied up in a scene and can't get free, we can figure a way to set a helicopter down somewhere to meet them. And we can, in turn, make the patient's transport time that much less.
The Mstraffic partnership with Medcom enabled to actually see in real time the accidents and different tie-ups on the interstates, etc. That's beneficial in patient care. My name is Jeremy Benson. I'm the lead flight paramedic and base manager for Jackson, Mississippi's aircraft, Air Care 1. Pre the Mstraffic project, the efficiency was not near as what it is now. We were able to go out to different locations, but didn't really have the hands-on and I guess the perception of actually seeing what's actually going on in the surrounding areas.
With the MDOT cameras, you can get a more broad view of where the aircraft's coming in from, what the LZ looks like, if there's any obstacles that the ground crews might have missed. Those kind of things we can see with those cameras.
In Mississippi Medcom, we have access to many different radio frequencies, law enforcement, EMS, fire, and we'll hear an accident get dispatched out. We then go to the Traffic Cam system, try to locate the accident, and we can start noticing when ambulances and fire trucks get there, how many backboards they're pulling out, and physically the cameras are good enough to count the number of patients being loaded onto backboards and loaded into ambulances. And since we are the state's only Level 1 trauma center, most trauma will come to UMC.
What's fascinating is you have two state agencies that are working really in two traditionally different fields. But if you look back on it, EMS and paramedicine and field medicine really started out of a initiative by the Department of Transportation to help decrease mortality on the roads. And so here we are again in the same exact situation where we're working together again to help decrease that mortality.
Because this is a great joint effort to bring emergency management or emergency medicine in with their program. And they expanded it. I think it helped out both parties. I mean, it definitely helped us. There's no ifs, ands, buts about that.
In terms of selling, it was quite simple. This is logical. EMS originated out of the traffic system. EMS will grow out of the traffic management system and transportation system. This works.
In order to share that video with the university, we were able to quickly and easily enter into an agreement with them. They, location-wise, are very close to our fiber network. They're very close to the TMC here. And so it was a real easy process, but is a real unique opportunity in that we're one of the first states to actually partner with a medical facility as a state agency.
The total connection piece of technology between the two divisions was around $100,000. The medical center put in 75, and that was running fiber, redundant cable, and getting the system to monitor. And MDOT put in roughly $25,000 to ensure that we had the right connections and ability to see and use their cameras appropriately.
And we feel like, you know, it's a little bit more costly way of doing business than we did in the past and they did in the past. However, you know, when you talk about the value of lives and the value of minutes spent getting an ambulance to a person or getting a helicopter to a transfer patient, we feel like it's worth it.
Basically, anytime we can move patients faster to an appropriate facility, the patients win. The state wins in that aspect.
We can do all we can in the hospital. We can be the best in the world, whether it's us or hospitals across the state. But if we can't get patients to us fast, and we can't get patients to us in a good condition, then all the surgeons in the world, and all the ER physicians in the world, and all of the other technologies that are at bigger hospitals are not being utilized if we can't get a patient here quickly. And this partnership has allowed us to do that, to reach out, to understand, to push data out, and bring patients in faster to us and to other medical facilities across the state.